I'll be briefly talking about pharmacokinetics and dynamics because basically they are the basis of pharmacology. Okay? People take courses just to learn about pharmacokinetics and pharmacodynamics. So what are they? Okay, I'll just talk about them briefly. Pharmacokinetics, what the body does to the drug. While dynamic, what the drug does to the body. Pharmacokinetics is divided into 4 stages. Whenever you hear the word pharmacokinetics, you think about absorption, distribution, metabolism, and excretion. These are the steps which the drug undergoes until it is eliminated. Okay? Yeah. First of all, they are being absorbed to the systemic circulation. Any drug, whatever that drug is. And after that, of course, they will be distributed. They will go to the site of action or even other targets, and then metabolism, okay, in order to do the action, and finally they will be excreted, eliminated to the body after they have done their action, their job. Absorption differs or depending in the route of administration. You have the percentage of absorption. Sometimes, like for example, when a drug is being given IV fluid, 100% will go to the systemic circulation. Others, and rapidly. So these are the advantages of intravenous administration. Rapid onset, okay, especially if you have a patient, okay, that he is unconscious. How would you give him a drug orally? Okay, so you need, and he's unconscious, and you need to give him the drug or otherwise he will die. Okay, so either use intravenous or intramuscular, but intravenous 100 bioavailability. This brings us to another term, bioavailability. Okay, bioavailability, how much the drug being absorbed to the systemic circulation. So IV 100%. Okay, this is all what absorption talks about. Absorption, we want the drug to get into the systemic circulation, to get into the blood, because the blood is like the highway of the drug. In order for that drug to go to the brain, to go to the lungs or whatever, they have to get into the highway, to get into the blood. But how much? Sometimes less than 100%, sometimes even like digoxin, 70% if you give that orally. Because the problem, this is common sense. Why IV 100%? Because it's directly being given to the systemic circulation. No barriers. But when you give that orally, okay, there are a lot of barriers. Enzymes, the pH of the stomach, you have the liver, first pass effect. There are enzymes in the liver. It's the factory of enzymes. It will for sure degrade some of that drug. So eventually have less. Okay. So now we talked about different route of administration. Okay. And depending on the route of administration, you have the percentage of bioavailability. Okay? So after that, after the drug being absorbed, it will get distributed. Okay? And you have to keep one thing in mind. The drug, as long as the drug is bound to a protein, it's inactive. It's inactive. Okay? Free drug, active. This is what you need to know, I think, about distribution. Of course, there are formulas, but just I want to go through all of them. Okay. Then after distribution, they will go through metabolism. Metabolism has two phases, phase 1 and 2. Phase 1 is basically either oxidation, reduction, interaction. Phase 2, conjugation. So what is the main purpose of the metabolism? Either we want to activate the drug or inactivate the drug, okay, or make it more soluble. Why? In order to be excreted. Okay, so assume the drug just being there in the body, of course it will has toxic consequences. It has to be eliminated. Because of that, they get more soluble. Phase 2 has many types of reactions, such as acetylation, okay, the addition of glutathione, glucuronation, okay, depending on what is being added to the molecule, to the drug. You have the name of that process. And finally excreted, mainly through the urine. So this is pharmacokinetics. Pharmacodynamics, I hope you understood the first part. Pharmacodynamics. Again, I want you just to connect things together. If you did not get anything from pharmacokinetics, just remember the 4 stages: absorption, distribution, metabolism, and excretion. Pharmacodynamics, I want you to remember the agonist drug and partial, full agonist, partial agonist, and the antagonist drugs. What are these terms? Okay, they are really confusing. Agonist, what do you mean by that? Okay, just, it's simply, it's activating the cell. That's it. Enhancing the action, whatever you say it. Okay, but eventually we want the response. This is why we give a drug. We want a response. This is the meaning of agonist, either full or partial. And even from its name, full means maximum response. Partial response. It's common sense. Okay? So don't just go confused whenever you hear such words, such terms, agonist and No, it's just easy. And antagonist, I think by now you should know. What does that mean? Antagonist blocks the action. Inhibition. So you have either blocking or activating. What do you mean by blocking? The drug comes to the receptor, blocking it. Okay? So nothing can come and fit to the receptor. Okay? After that, let's get to also another important concept, which is the lethal dose, median dose, okay, median affecting dose and median lethal dose. You want to know the right dose to give to the population. Effective. We don't want to give doses that are not effective and at the same time toxic. We want to give the maximum response. Because of that, we have this curve showing us that by certain concentration we have the maximum response in the y-axis, while in the x-axis you have the concentration of the drug, showing you the effective dose and the lethal dose. Okay, so by dividing lethal dose by effective dose, you have the therapeutic index. Then you could decide really the right amount of dose. Okay, and I think that's it. Thank you.